Yeah, so my name's Joanne Davies and I'm a director of care at My Care, My Home. Okay, so we currently provide around 2,500 hours per week. We have offices in South Wales, in Wigan and in Wirral. We have approximately 130 staff and we provide services to around 274 individuals. So we were using a different system. We were part of a much larger organisation. We split from them, but we still use the same rostering system that they'd used. So once we'd sorted out all the rest of the things that we needed to in regards to infrastructure, with staffing, office support, etc. Then was the time for us to start looking at the rostering system, because we didn't feel that the rostering system we were using at that time, met all the needs of the business. We needed something that was had ECM incorporated into it, and the functionality was much better with CareLineLive. Obviously, we looked at other products, but CareLineLive actually was the one that we decided to go with. The reason for that was, not just the rostering system, but the other functions as well, like forms. There's assessments. We felt that the information that we could input into there, was much better than we'd used previously. We liked the fact that there was instant journal entries that we could look at, the ECM, so we could see, people logging in and out of visits, being able to put tasks on the system, documents, they were all things that we weren't able to do with the previous system. It just meant that, with the alerts that were coming through as well for, the ECM, that we'd able to make sure that there were no missed visits, by contacting staff members to make sure that they had actually arrived at the visits. And the other thing for us as well is, the EMA, previous ways of working using documentation that was held within properties was quite difficult to get returned to the office. And certainly if we needed to look at something quickly, we didn't have that function, whereas because this is totally live, when we get information immediately as it happens, it was just really useful. It's really useful for us. So if we do have a query coming through from the local authority, for example, or a family member, we're able to answer it immediately. So overall, CareLineLive, is a much better system than we've used before. I mean, a lot of contracts with local authorities, for example, they require you to have, an ECM system, number one. So that's had a massive impact for us because obviously it's helped with invoicing, for obviously for the financial situation of the company. And like I said, I think the biggest impact for us is, we have that immediate information to hand, should it be required. The staff also, can raise concerns on the app that they use, which then leads to us supporting them, in real time, and able to do incidents immediately, and be able to, see the process from start to finish, in regards to, any incidents that occur, and the support that we provided as well. So it's a really good tool, in order to make sure that the right support is being provided, in those type of situations. I think the other thing for us is, certainly is the EMA. The impact of that has been massive for us, because what we found previously were that MAR charts would, be out of date. There was quite a lot of admin work in regards to that and making sure that, they were bang up to date for that individual. So you know, if they had somebody came into hospital, for example, and had another medication added, you know, is immediate for us now. It doesn't, you know, it just doesn't mean that we have to visit that actual property or, you know, liaise with a pharmacist, for example, you know, and try and get a MAR because not all pharmacies are willing to provide those. You know, so that's had a really big impact for us. I do reports on a monthly basis for the branches. And I think the reports on the system as well are really effective to see exactly where the business is. You know, how many service users we've taken on, how many have left the service, you know, how many service users, for example, have been suspended, you know, through hospital admissions. You know, it's easy to run the hours reports, you know, and anything to do with staffing, you know, so it is really, really, you know, been such made a massive difference to us as an organisation. For us, I think in regards to documentation then, so the reviewing, you know, of paperwork, etc. for a service user, it is making sure that when we update our paperwork, it's immediate, that the staff can see it immediately as well. So, you know, if there's any change, you know, in that individual's needs, for example, or risk, you know, we're able to make sure that they've got access to that information immediately. It allows us to make sure that, you know, we can add extra tasks on. So if there's a change, you know, so the care staff actually have access to everything that they need to ensure that they're meeting the needs of the individuals that they're supporting. Yeah, so both, so CQC and CIW. And the other thing I think in regards to compliance, you know, with the regulators, we're able to track, you know, the reviews, not only for the service users, but for staff as well, making sure that we have, you know, not only reviews that have been carried out, but those that are due as well. And it helps us to keep on top of, you know, all of those things in regards to, you know, the regulation. So, for example, in Wales, we have to carry out a review and update service users' paperwork every 3 months. You know, so we're able to plan, you know, all those reviews and paperwork updates, and have a list to work from, you know, the ones that are due, any that are out to date, for example, and the same with the staff. You know, making sure that the spot checks, the competency checks and the supervisions, appraisals, etc. You know, there's a good track of those as well. You know, so and being alerted to the fact that we need to complete them. You know, so that's really helped in that regard too. Yeah, I think it's grown with us. You know, when we implemented it, you know, obviously we all had to learn how to use it, certainly the office team, you know, and the community teams really. And I think as we've progressed, you know, over the last few years, obviously we've been able to, you know, utilise more of the tools that are available, you know, through the system. So I think we've grown over the last few years of using it. We have been able to change our way of working in regards to paper-based. You know, it's had a really good impact for us. I mean, it's taken us some time to get there, you know, but we are there now. We've been able to create our own forms in the system, you know, which provides, you know, a review date, you know, and version number, you know, so there's a clear evidence of, you know, things changing and things happening. So that's been really useful as well. And we've, you know, we've actually saved a few trees, you know, moving to the new way of working. So yeah, it's been really effective. I did it. So I transferred everything over myself. It was doing it myself was really useful because obviously it gave me much better insight into the system, and then I could impart that then onto my team. You know, obviously CareLineLive provided some really good training for us, you know, initially. And I think all the office team have learnt really as we've gone on. You know, like I said, so, you know, being able to use, you know, more tools that CareLineLive has to offer. It's cut down on the time, obviously completing, you know, the rotas, being able to, you know, schedule the runs for, you know, staff, easily being able to drag and drop and not just one call at a time, you know, but being able to, you know, move a shift between care staff, you know, has really been useful as well. You know, and by being able to schedule the runs as well, they're able to easily see where they've got capacity, you know, enable them to take on, you know, further individuals who need our support. You know, so it's really, really simple, you know, for them to see where those gaps are. The only thing for us, I mean, it's going back a little while now, was obviously the training matrix, because whilst we were adding training to the system, you know, there wasn't really an easy way of us seeing it. You know, but obviously with the training matrix being added as well, that's really useful as well for us, because we can easily see when, you know, staff need to update their training, you know, etc. as well. Car documents, for example, you know, all the things really that we need to make sure that our staff have. Yeah, so it's been really useful. I would just say, you know, go for it. You know, it is a really good system. You know, we've been so happy with it, and the support. It's not just about the system; it's about the support you get too. You know, from you guys. You know, so you know, questions are always answered. You know, if you need that little bit of help, you know, there's always somebody there who can support you. Plus the help guides, I think, are really, really useful. You know, when you're stuck on something, for example. But I just think in general, I just think it's such a good system because everything's in one place. You're not having to use, you know, a couple of different systems to get everything that you want. So yeah, I would recommend it. I really would.